Today we're answering the question, very popular question by the way, is what is healthcare going to cost me in retirement? There are all kinds of statistics out there, and sometimes, unfortunately, as we all know, when people on the internet or TV stations or media outlets are trying to get extra attention so they can sell more advertising, they tend to be a little startling or a little crisis-oriented in their statistics. There's one statistic out there that says you need to have $250,000 saved for things that Medicare or Medicare supplements will not cover in retirement. Now, to some people, they hear that number and they just get overwhelmed. I've had people say, I've just barely saved enough for retirement. I just feel secure in my retirement. Now I'm being made to feel bad about my situation because of what I'm reading. So the first thing I would say is, retirement isn't always perfect, and not everybody can walk into retirement with an ideal financial situation. So we like to tell people, look, let's deal with one step at a time. If that number seems very large, even if it is accurate, I'm not sure it is, but if that $250,000 number seems large, then let's just take it one bite at a time. Maybe you want to say, well, I've got to have enough insurance to cover the need, but if I don't have enough money to do that, then I'm just going to have to live with accepting some risk in retirement. Most people, once they reach age 65, they're enrolled in the Medicare program automatically. It's part of what we paid into when we were doing our payroll deduction that also included Social Security. And Medicare covers most of big insurance needs with a deductible, and then most people buy what's called a Medicare supplement policy or a Medicare Advantage policy. So there's some premiums involved, and the higher your income, the higher the premium. So it stays reasonable and pretty equitable what you have to pay. I think my mom and dad pay a couple $100 a month, maybe $250 a month for both of them to be covered with a Medicare supplement policy. So it is pretty reasonable. But again, it's not always going to cover everything. It definitely doesn't cover long-term care. So that's the big hole that most people have, is that long-term care issue. So for me to tell you exactly what it's going to cost for health care in retirement or to buy health insurance in retirement is almost impossible. But what I would say is it needs to be worked into your monthly budget. So let's say you want an income of $5,000 a month and you want that to be able to spend. I would include in that need an additional few $100s per month to cover any kind of Medicare supplement type of a policy. And for most people, that will be adequate. Hopefully that answers your question on how do I deal with health care in retirement. If you do retire before age 65, we should have a conversation because there are some other options available there, and that is a little bit more of a critical period, because once you reach 65, you can roll into Medicare. Before your age 65, right now under current law, you can't do that, and you might need to buy supplemental insurance or go into the insurance exchange that was created under the Affordable Care Act. If you enjoyed this topic and you want to hear more, just click on the link.